Relief was written on the faces of Kilifi Eye Hospital staff, who were delighted to receive a timely donation of eye health equipment from the Fred Hollows Foundation in partnership with the Latter-day Saints charity. The equipment included operating microscope, A-scan, autorefractor with chirometer, equipment sterilizer, cataract sets, lead sets, glaucoma sets, slit lamp, indirect ophthalmoscope, among others, which will help service people from the surrounding region who would otherwise have to travel long distance to receive eye care treatments. Kilifi Deputy Governor Gideon Samburi said he was concerned about the eye health services in the county and was willing to devote millions of shillings towards supplementing government's effort to improving the sector.
Thank you once again for coming in and taking up this, coming to partner with us to try and see how we can then move forward, forge forward together. We want you to feel that they're appreciated, and we want to go along with you. And we hope this journey will be a journey that is going to give us both satisfaction when we see our people have improved eye diagnosis and further even surgeries happening within our area.
According to the Fred Hollows Foundation's Kenya Country Manager Jane Ohuma, the Fred Hollows Foundation is in the process of identifying needy eye health facilities in the region in order to help them improve eye health services in the facilities.
Through this equipment that we are providing about 6 million, and this is the start of our journey with Kilifi County. Looking forward to your support, the governor's support for program-based budgeting, that as we start this partnership and we come, as we get funding, with the equipment, with training of eye health staff, we also invest in the community.
And when you walked to the clinic, it was so unfortunate that we had an ophthalmologist, but the only thing she had was a torch. Now you can imagine, here are a number of people who are suffering coming to the facility to seek eye health services, and they couldn't get it. And you had to refer them all the way to either Post General or Lighthouse or Christ Eye Center.
The CEC Health Services Honorable Charles Dandu said people will now access eye health services at the hospital rather than having to travel to Mombasa and Nairobi to look for services.
So I would imagine by now the inventory is complete. Okay. I would imagine by now our biomed are okay. Then in terms of security.
He added that the partnership aims to improve on service provision by ensuring eye health services are made available through all sub-county facilities by improving on human resource, that is training of medical teams, general infrastructure development, and improving community awareness for uptake of eye health services.
Every 5 people who are blind, 4 of those people need not be blind. Why? They need not be blind if services are taken to them on a timely basis. And that means if there is skilled personnel, there is equipment, and people who are also enabled and educated, the importance of eye health. We are now talking so much about non-communicable diseases and the relationship between blindness and NCDs, especially diabetes and hypertension.
We are looking at strengthening community participation in ensuring that patients are able to come to facilities, whether at the county referral hospitals or at the sub-county facilities. We also want to see that there is proper infrastructure for these services to be offered. Apart from that, most importantly, to have the right human resource to offer these services, amongst other things.
Lucky enough is that Kilifi County has an established community system. We have a community strategy for the persons in every sub-county, and we have community units. Each sub-county with their heads, And if we want to get through the community strategy, I tell you, it is easy for us to be able to train the community health volunteers.
The equipment will go a long way in service delivery as hundreds of patients flock to the facility from various parts of the county in search of eye health treatment.
Eye health is very important, and I think as a country a time has come that we need to put on more resources in terms of human resource, in terms of equipment, and most importantly what you talked about in terms of sensitizing also our community.
So we are very much happy to be here. This partnership has been made possible through the partnership of Fred Hollows Foundation and Latter-day Saints Charities, a US-based organization.
The donation of equipment has been made possible through the support from the Latter-day Saints charity.